If rest actually fixed knee, back, and shoulder pain, I would be out of a job. And honestly, I would probably be fine with that. But every week I see people who did everything right. They rested, they iced, they stretched, they even watched YouTube videos at 2 a.m. looking for answers. And they felt better for a while. But then the pain came right back like a bad sequel nobody asked for. So what's really going on? Why does joint pain keep returning even when nothing is technically wrong? And why does knee pain, back pain, and shoulder pain all behave almost exactly the same way? I'm Dr. Kellum, orthopedic surgeon and one of the team physicians for the Tennessee Titans and USA Basketball. And today I'm going to show you the loop that keeps joint pain alive. We're going to break down why your tissue gets stuck, why rest alone rarely solves the problem, and where tools like peptides actually fit in. Not as magic, but as a way to change the environment so healing can finally happen. Once you see this, a lot of joint pain suddenly makes sense. Most people think pain works like this. You hurt your knee, it heals, and you move on. That is how acute pain works. Chronic pain works very differently. Chronic pain is not a one-time event. It's a loop. And not the fun kind of loop, like watching The Office for the 7th time. It's more like Groundhog Day, except Bill Murray never figures out how to escape. When you irritate your knee, your back, or your shoulder, your body responds with inflammation. That part is normal. Inflammation is how healing starts. The problem happens when that tissue never fully recovers. This rubber band is your tissue at rest. Now you irritate it with activity. Maybe you decide to move your couch by yourself because you're an adult and you can handle it. Your body responds with inflammation. That is the alarm system kicking in. So you rest and you use heating pad and then the pain improves. But then you go back to normal life. You pick up groceries, you bend down to tie your shoes, you exist, and the inflammation comes right back. This is the loop. Irritate, inflame, rest, repeat. And yes, I know, rubber band, very high tech, but this is exactly how your tissue behaves. You feel better for a minute, but the problem never actually goes away. When tissue stays in this constant inflammatory state, it becomes a hostile environment. And the real danger is not the inflammation itself, it's what happens next. Now, here's the thing people get wrong. They say, my knee pain is different from my back pain, or my shoulder issue is completely separate. From an orthopedic standpoint, the location changes, the mechanism doesn't. It's like how every Fast and Furious movie has a different title, but it's basically the same plot. Family, cars, something explodes. With joint pain, it always starts with irritation, overuse, poor mechanics, and old injury, and repetitive stress. Your body responds with inflammation. Then your nervous system steps in to protect you. When I move my shoulder, my muscles tighten automatically to guard it. That protection is helpful short term, but long term, it creates new problem. Muscle guarding cuts off blood flow. Less blood flow means less oxygen, fewer nutrients, and weaker repair signals. The tissue stays irritated, guarded, and stuck. Your knee does not know it is a knee. It just knows stress. Think about it like this. If you were a plant, inflammation is like being stuck in the shade. You're still alive, but you're not getting enough sunlight to actually grow. You're just kind of sitting there like a sad fern in a college dorm room. This is why people say that they try everything and nothing works. It's not because they are broken, it's because they are trying to heal in conditions that do not support recovery. Which brings us back to the environment problem. So where do peptides fit into all of this? First, peptides are signaling molecules. They are short chains of amino acids your body already uses to communicate. In regenerative medicine, we use specific peptides to calm the inflammation and support repair signals. The two I use most often for knee, back, and shoulder pain are BPC 157 and TB 500. I call this combination the Wolverine protocol. No, it doesn't turn you into a Wolverine or give you adamantium claws. I checked. Here's what it actually does. BPC 157 helps quiet the inflammatory noise. TB 500 helps signal that it is safe for tissue to start rebuilding. Together, they help move tissue from inflammation mode into repair mode. They help move your tissue out of the bad environment, out of the shade. But here's the part that matters the most. Peptides are not a fix. They are a tool. They create an environment where your body can respond to movement, to rehab, and to recovery. You still have to do the work. Think of them like a construction site. Peptides do not build the house. They just stop the workers from fighting each other so they can actually get something done. If Tom Brady could peptide his way to 7 Super Bowl rings without training, trust me, he would have done it. But even the best recovery tools in the world still require you to show up and put in the work. This is not a cheat code. It's more like upgrading your tools so that the work you actually do sticks. If this is making sense so far, hit the subscribe button and turn on notifications. I'm making more videos like this on orthopedic pain, regenerative medicine, and what actually works for long-term joint health. Real information that might actually help you. Let's talk about who this is for and who it is not for. Peptides are not for everyone. They work best for people stuck in the bad environment or shade for more than 3 months. Pain that improves with rest but comes back with activity. People who have tried physical therapy, stretching, rest, maybe even injections, and nothing has stuck. Athletes or active people who cannot stay consistent because every time they ramp up activity, the pain comes back like a bad ex. People who want to avoid surgery or trying to delay surgery as long as possible. That is who it benefits. Now, who does not need peptides? If your pain just started, if it's an acute injury, probably don't need peptides. Your body can just handle acute inflammation on its own. If you have severe structural damage, a complete ligament tear, a fracture, significant bone-on-bone arthritis, peptides are not going to fix that alone. You need a different conversation, probably one that involves an MRI and maybe some uncomfortable questions. And if you've never done basic rehab, if you've never addressed your movement patterns or strengthened the muscles around your joint, start there first. Peptides are a support tool for people whose tissue is stuck, not a shortcut for people who have not done the basics. All right, let's bring this full circle. Knee, back, and shoulder pain follow the same pattern. Irritation leads to inflammation. Inflammation creates guarding. Guarding cuts off repair. Peptides help shift the state of your tissue so healing can actually happen. But they are not magic. They're just tools. Think of them like noise-canceling headphones for your inflammation. They do not solve the problem by themselves, but they make it a lot easier to focus on what actually matters. And what matters is giving your body the right conditions to heal. If this made sense, hit the subscribe button. I will be doing more videos on orthopedic pain and regenerative medicine. Drop a comment below. Knee, back, or shoulder pain? Which one do you deal with? Or if you're lucky enough to have all three, just let me know so I can send you a fruit basket. I'm Dr. Ethan Kellum. Stay strong, stay healthy, and remember, the best surgery is the one you never need.